Cry It Out Loud, a podcast by Chasing the Rainbows with your host, Bernice Quisenberry.
Welcome to Cry It Out Loud, the podcast where we hold space for the raw, real, and unfiltered stories of life after infertility, pregnancy loss, infant loss, and pregnancy after loss. I'm Bernice, founder of Chasing the Rainbows, an organization dedicated to supporting families and navigating these unimaginable experiences. Through daily trauma-informed support groups, resources, and this podcast being one of them, we're here to remind you that you don't have to walk this path alone. So today, I'm honored to welcome Lori Zolp from Wisconsin to the podcast. Lori's journey is one of incredible resilience. She experienced the heartbreak of miscarriage, baby loss, endured 2 traumatic pregnancies that brought her 2 living children, and eventually made the courageous decision to pursue surrogacy. Her journey is one of grief, strength, and finding hope, even in the darkest of circumstances, and now is a mental health advocate. Welcome to the podcast, Lori.
Hi.
Thank you so much for being here.
Of course.
So for our listeners to hear, please go ahead and tell us all about, your story, how you met your husband, what that looked like when you were planning children, and, dive into any aspect of it.
Yeah, I can always be a chatty Cathy, so I'll try to keep my story as concise as I can, even though it's a long one. I met my husband just about 10 years ago. And I remember while we first started dating, we actually talked about kids like right away. We actually said, I love you the night we met. And we always said that we wanted 3 or 4. I come from a big family and he just has 2. He just has 1 brother. And I always just had told him that like I had this desire to have like a big family. Like I liked being in the chaos growing up. And we came up with kid names right away. And in that first year of dating, I actually lost my cousin who she was my age and we were very, very close. And she had 2 siblings, a sister and a brother. And I just remember thinking, I don't know how I would get through it if I were one of her siblings, if I didn't have the other sibling to like get through that with. And I think that traumatic like moment really ignited this like fear in me of like losing a child and wanting more than like 2 and then right after that, I also had a friend who died and he was a twin and he only had his twin. And I just remember like so much happening, so much death in that first year that just, I was like, I have to have 3 or more kids because what if I lose one? I need them to have like another sibling. But I wanted more kids even before that. And then my husband and I got married in 2018. And a month after our wedding, I was on antibiotics. And I didn't know that antibiotics can affect birth control. And I wasn't really afraid anyways, because at that point we were married and we wanted kids. We weren't on any sort of timeline for kids. But the following month after I was on antibiotics, I didn't get my period. And I remember I had my, some friends over and my sister over for dinner. And I was like, I'm just very nauseous and I haven't got my period. And I'm like 2 or 3 weeks late. And one of my friends was like, you should take a pregnancy test. And I was like, but I'm on birth control. So like, that doesn't really make sense, because I had been on birth control for 7 years and I really had never had any issues with that. And so then the next day, I went and I got a pregnancy test, but before I even took it, I was in the shower and I just felt like this horrible, like cramping and like a pop sensation and just like tons of blood. And I just remember thinking, because I was so young, I was 23 when I got married. And so I was 23 when this happened. And I just remember thinking, this doesn't feel like I just suddenly got my period. It felt like a lot more blood. I had never got my period where it was just like a gush like that. And my heart kind of sank and I called my husband. I was crying and he was hunting. And I was like, I feel like I just like had a miscarriage. I don't know why, but like I just like tons of blood just came out of me and I'm still bleeding. And so I called, and at this point, again, I'm only 23. So I didn't have an established OB. So when I called and told them what was going on, I was like, I'll take the soonest available appointment. And so they scheduled me with, just like a random OB. Actually, I'm still not even sure to this day if it was an OB or a nurse practitioner. The doctor said to me, you have some scar tissue. You had a miscarriage and, I'm so sorry. They said all those things.
Yeah.
And then they walked out. They said, take as much time as you need getting dressed. And then I remember walking out and just being like, do I just go to the lobby? I had never been through this.
Right.
And I remember getting in the car and I'm crying. I call my husband because he's still hunting and I tell him and he starts crying. And then I start, making some calls to people and I'm just crying. I'm like looking for support. I don't know how to feel because I was on birth control. So it's like, this baby was wanted if I was pregnant, but it's not like I was trying for the baby. And I just remember lots of people in those first couple of weeks saying things like, well, but did they do a blood test? Do you know for sure? Did they confirm? And I already felt really weird because I felt like I didn't deserve to grieve because it wasn't a baby that I was trying for. And then adding this on top of it, I mean, I actually started to like question myself where I was like, did I? And then I remember every doctor appointment I would have for the next like year, or even honestly, until recently, people always ask you when you go to, especially OB appointments, they say how many pregnancies and how many live births. Yeah. And I would always be like, how many pregnancies do I say? Because I never got the clarity that I actually had a miscarriage. And it was just really triggering in that first year. So for a year, then at that point, we decided that, circumstance led us to be like, we want children and we want them now. So we started trying. I went off of birth control. And at that point, I thought, if you go off birth control, you're going to get pregnant right away because that's just like what you're told, like as a young girl, like if you're not on birth control, you're going to get pregnant. Yeah. And I remember it just not happening for us month after month. I also remember confiding in people about the fact that like it wasn't happening. And if I did tell them about the miscarriage, they would be like, well, at least, you can get pregnant. And I was
where you should. No.
Yeah. And I just remember, again, like I was so young, I was only 23. And I just remember thinking it took a long time for me to realize that infertility isn't just not being able to get pregnant. Infertility, a huge aspect of it is not being able to maintain a pregnancy. But I didn't know that at the time. So again, it was just all that.
No, right. Yeah.
Yeah, I know we've talked about this, but like that term gaslighting, like I hate using it because it feels so traumatic. But
I know
it really did over the course of a couple of years. It just started to make me really question my own reality and if I was being dramatic, if I was making something up to make myself seem more relatable or whatever it might be. And I just remember over those or over that year just watching what felt like everybody was getting pregnant. And I'll jump forward really quick since we're on the topic of that miscarriage. It wasn't until recently that I established with a new OB because my OB during my pregnancies had left. And in that initial consultation, this was just a few weeks ago, she said to me, she was like, so it looks like you had a miscarriage in 2018. And I just started crying because I was like, oh my gosh, it's in my file. Like it's not just me. I'm not crazy. Oh my gosh, it could make me cry right now.
I know. It's that validation, Lori. I know.
Yeah. And it's the validation of a doctor being certain enough that they wrote it down in my file. And I just had never had anybody say that to me. And so fast forward or rewind back to that. And like I said, I felt like everybody was getting pregnant. And I started getting really concerned because about 9 months after trying, at that point, we started introducing like the really trying, where we were tracking my ovulation, taking my temperature, tracking in an app, looking at all the signs to see when I was fertile, when I wasn't. And then I really was getting concerned when I started doing that and still not getting pregnant, because the first like 6 to 9 months when we were trying without doing that, I was like, well, we're just kind of letting things happen as it should. But when you're putting that much effort in and you're tracking your ovulation, in your brain, you're thinking there's no world in which I shouldn't be getting pregnant now, because I'm doing all the things to know when I'm ovulating. And so at that point, we had reached out to a doctor. They got me in just before it had been 1 year of us trying.
Yeah.
And we started doing some of the testing, and they had told me at that appointment, they said, normally we wouldn't start testing with only 1 year of not getting pregnant, but because it's been 1 year and you've had a miscarriage, we will start doing some testing. And we found out pretty early on that it was actually like my husband's, testosterone that was low. But they said there was really nothing they could do for that, because low testosterone makes it difficult to get pregnant. But if you treat it by introducing testosterone injections, that also can affect a man's fertility. So we were kind of like, what do we do? Right. And thankfully, as soon as we got that like in the mail, we got like the letter in the mail telling us what to do. A week later, we found out we were pregnant. Oh. And it was like the best thing ever. And this was a year later. So my husband was hunting again. And I remember taking a test and thinking it's not going to be positive, because it hasn't been positive for the last year. So I took it and I set it on the counter, and I tried to go back to bed because it was like 5 a.m. And like 30 minutes later, I was like, I couldn't sleep. And I was like, I have to go look. I just have to. I went and I looked, and I saw the faintest positive. And I remember like turning all the lights on and being like, I'm crazy. There is not a second line. And I wanted to call him, but I was like, no, this is like the perfect moment to like plan something. So I won't get into all that, because I know we don't have the time for me to like give every detail, but announced it to him in like a very special way. And we announced to our families shortly after. And it was like the best week and a half of happiness and bliss. And I remember writing notes every day saying like, I think I'm feeling nauseous. And I was excited to be feeling nauseous. Like I was so happy to be experiencing symptoms, because I had wanted it for so long. And I'll never forget, I was 5 weeks and 6 days, and I woke up and I felt very dizzy, and I immediately ran to the bathroom and I started puking. And I wasn't that like nervous at first, because I was like, oh my gosh, it's the morning sickness kicking in, which again, I was so young. I was 24 when I got pregnant, and I didn't know that was very early to be experiencing any kind of symptoms. 5 weeks and 6 days. Like some people don't even know they're pregnant then. Yeah. And I just remember, so I trigger warning for anybody who's experienced traumatic pregnancies. I'll go into detail because I never explain it in detail for people. What happened that first day and what happened to me for a long time is I puked, but then it was the morning, so I didn't have anything in my stomach to begin with. And anybody who's ever had like the stomach bug or anything, when you have no food in you, you start dry heaving. But when you have no food in you, your stomach is trying to get that bile out. And so a lot of times you do that retching and your stomach curls in, and it's like your body does it without you like you can't even help it. Sometimes it's just like doing it. And I remember that starting to happen. And I was, I've had the stomach flu before. So again, I was just like, okay, I have no food in my stomach. Maybe that's it. But I remember it starting and it wasn't stopping, and I couldn't get my body to stop doing that.
Yeah.
And I was fully conscious and I was watching myself lose oxygen. Like I was starting to turn blue. I couldn't breathe and I was trying to get it to stop and it wouldn't stop. And I was so scared for my life in that moment. Like I was like, oh my gosh, I'm not breathing. And I'm like aware of it. Like, why can't I get myself to breathe? And it just wouldn't stop. And the next thing I know, I'm on the floor and my husband's holding me, crying, like freaking out. And then I'm crying. I'm like, what's going on? And then it just starts happening again. Like as soon as I come to, it starts happening again. And then I pass out again. And basically this just happened where I'm just waking up. This is happening without me even like, I couldn't even get like a sip of water and I couldn't do anything because it was happening so much. And when it would happen, like I said, there was nothing I could do to get my body to like stop doing it. And it was terrifying. And I think it happened like 5 times. And my husband's like, is she dying? Like neither of us knew what the heck was going on. He's like, is she dying? Like what is going on? And so he calls 911 and he's like checking my pulse, telling them like, you know, I don't know what's going on with her. So I go to the ER.
Yeah.
They give me nausea meds. And, you know, as soon as they give me nausea meds, I was like, oh, I'm good. Okay. So I leave, we go home. Within 2 hours, it starts happening again. So then he brings me back. And within 3 days, I had just been like in and out of the ER. And finally, after that 3rd day, we were in the ER and I had a doctor that was like, if we keep giving you these meds, or I can give you meds that is going to make you feel better, but you're going to kill your baby. And this doctor was like, I'm going to let you think on that. And I'll never forget that it was the most mind-boggling thing, and not to be stereotypical, but it was a female doctor that said this to me. And I had a male nurse, which is, again, not to be stereotypical, but oftentimes it's a male doctor in the ER and female nurses. And I remember having a female look at me and say, you're going to kill your baby if I give you these meds. And she like crossed her hands and just kind of like waited for me to give an answer. And I was sobbing. I was like, I'm supposed to just give you an answer right now? Like, what am I supposed to do? And so she leaves and the male nurse puts his hand on my leg and he was like, I've just watched you for the last like 2 hours pass out like consistently, like you can't even help it. Like it just happens. And he was like, when you do pass out, then I was convulsing while I was unconscious. And he's like, I have never seen this and something's wrong. I'm going to get you admitted. Like this is severe. So I get admitted and I just have a bunch of doctors. And at this point, I also haven't met my OB yet because you don't meet your OB until about 8 weeks.
Yeah.
But my OB that I had established with did come to the hospital to visit me and to talk with me. Meanwhile, I had other doctors and they all were just like, we're just diagnosing you with super severe hyperemesis. And I was like, okay, like that, it seemed fitting at the time. Like I was just like, okay, I guess I just have like super severe morning sickness. And so they started trying some different medications and I had a doctor come in that was like, we really want to try you on a medication called Compazine. It is not only really great for nausea, it actually helps people gain weight, which at this point I had already lost like 15 to 20 pounds. And they were like, it helps you gain weight. It helps with nausea and puking. And then it also is really good for anxiety and depression. Like it's also like a combination with mental health, which at this point, like my mental health was a huge factor of it. Yeah. I had severe panic attacks my whole life, and I didn't really know that the two were correlating at the time. So they start giving me this Compazine, and in the morning, they had come in to give me my 3rd dose. And my mom was with me during the days, and my husband would come be with me at night. And so my mom was with me at this point, and somebody came in to talk to me. And I just remember I kept looking at my mom and being like, I'm so sorry to the person I was talking to. I'm like, I'm so sorry. I'm trying to listen to you, but like something's wrong. Like something's very, very wrong. And I kept telling my mom my face felt weird, but I couldn't see myself, or I couldn't see anything. And she noticed something, but she didn't say anything. And she was like, just relax. Like, and she comes over and she starts like massaging my temples. She's trying to get me to relax. And she's like, Lori, calm down. And I was like, I don't know what's going on. I don't know. And I just started losing my ability to speak. And I couldn't see myself, but lo and behold, I guess everything just started doing weird, like muscle stuff on one side of my body. And the person that I was talking to was like, oh shit, like they didn't say that, but like their face, I could see it. And I remember they hit the code and people come running in, they have paddles, they have all these things. And that was also like a really terrifying moment, because similar to like me puking and feeling like I was dying while I was watching myself like lose air or oxygen, I remember people running in with paddles and all the things and thinking, I'm here, I'm conscious, like don't touch me with those paddles. But I couldn't say anything. I couldn't speak. I couldn't move. I couldn't do anything. And the doctor comes running in before they touch me with anything. And he was like, don't touch her. This is a really rare reaction to the medication. And he just takes something and goes right into my thigh. I don't really know, but it was likely an EpiPen. And I ended up having like a stroke response for a day and a half, because that medication had been in my system for 3 doses at that point. And so that happened. So then I couldn't be on that medication. So what they ultimately ended up doing was they discharged me after a couple weeks and had me do outpatient therapy. So for 3 times a week, I would go to a facility with like chemo patients. And it was really, really sad, because a lot of times they'd look at me and they'd be like, what are you here for? What cancer? And I was like, I'm just pregnant, and I felt, again, kind of going back to that.
Like, what box do you fit in?
Yeah. Like I just felt so sad, feeling like I was sitting with all these like cancer patients. And I'm like, what am I supposed to just say? Like, I'm pregnant, and like, I don't know what my diagnosis is.
Yeah. And
so I ended up doing the outpatient therapy 3 times a week, where they gave me nausea meds, they gave me anxiety meds, and they also gave me nutrients through the IV. And the medications were dangerous for the baby. So we had to stay on top of checking if the baby was developing properly. And I felt a huge amount of guilt of like, am I going to kill my baby, like this doctor said, which my doctors had told me that ER doctors should not have said that. They were like, yes, there are a ton of risks in giving a pregnant woman these medications, but it's also a huge risk of you not making it if we don't give you these medications, because you're losing weight so rapidly and you're passing out, you're convulsing. Like, this is all also unhealthy for the baby. So fast forward to 20 weeks pregnant, and I was still in therapy, but I was feeling good. Like I was able to go back to work and to live a normal life. Like I felt at that point I was like a normal pregnant person, where I would puke and then I would be good. I would get some food in my stomach. I would go to therapy, get my IVs, and I was good. Then 20 weeks, COVID happens. So the world shuts down. Everybody goes into quarantine. So I had to stop the IV treatments, but I was good at that point. And so the rest of my pregnancy was amazing. Like, absolutely loved it. I gained tons of weight. I loved it. I had all the cravings. Like, everything was great. So then we'll fast forward to my daughter. So everybody always asks me, were you afraid to get pregnant again? And my answer was always, and still is, no, I wasn't. Going into my pregnancy with my daughter, I thought one of 3 things were going to happen. I thought, one, no pregnancy is the same. So maybe this pregnancy won't be as traumatic or severe. Two, maybe I've been pregnant before, so now my body won't react so severely because it knows the hormones and it knows like how to process it.
Right.
And then I thought the third option was worst case scenario. I thought worst case scenario, it's exactly the same. And then I know I'm probably going to be hospitalized for a week early on, and then I'll do treatment therapy, until I'm 20 weeks. That was really what I thought was the only three options going into it. And so with my daughter, like we tried for her, we tried. And then that one was very different than my son. We tried 1 month and we were pregnant. And so we got the positive and I was ecstatic. No ounce of fear, nothing went through me. I was super happy. We cried, we laughed, all the things. And I immediately called my doctor and I said, I'm pregnant. I'm about 4 weeks. I was like, put the medications into the pharmacy, get me scheduled for outpatient therapy. Let's try to keep me out of the hospital if we can. And so at 5 weeks, I started my IV outpatient program right away. I already started my medications just to stay on top of it, to like keep me from ending up in the ER. And I remember I was 6 weeks exactly. And I was still feeling good. And I was like, oh my gosh, I'm going to make it through this pregnancy with no like severe symptoms because like I'm on top of it and like everything's good. And 6 weeks, one day, the very next day, I woke up and my husband, we would alternate which day took my son to daycare because sometimes my husband worked really, really early.
Yeah.
And so it was one of those days where it was my turn to take my son. So my husband was already gone when I woke up in the morning. And I woke up, I ran to the bathroom, I started puking and then passing out. And at this point, I know that I'm passing out because I've been through it before. And my son is screaming. I go to get him. I'm trying to call my mom and I'm like, you got to get over here. I'm passing out. And so she comes, she takes my son to daycare. She takes me to the hospital. They immediately admit me. And while they're okay, so I have to go back a little bit. So the medication that I was taking was Zofran, which most people who have ever, for nausea, it's a very well-known medication. So this angers me that nobody ever warned me about this because it is such a widely used medication and nobody ever tells you the risks of taking it. I had always been told by my doctors, if you take it and you puke within 15 to 20 minutes, you can take another one because it didn't hit your bloodstream. And so that morning when I was puking and passing out and I'm trying to get my son ready for daycare, I'm stressed out because first pregnancy, I didn't have to deal with taking care of another child. This time I'm like, what am I supposed to do? I can't drive him to daycare. I'm going to pass out.
Yeah.
And so I'm taking Zofran. Every time I puke, I'm like, okay, I'm going to take another one. And then I would just pray. I'd be like, get into my system. Just wait 20 minutes before you puke. And without fail, my body would just go back into that retching. I'd pass out. I would also start puking blood because when your esophagus is that damaged and you're retching that severely, it starts breaking capillaries and blood starts coming out. And my son's crying, like he doesn't know what's going on. He's scared. And so I'm in the hospital in the ER and they had given me Zofran via IV right away in the ER before they transported me up to the floor that I was going to be on. And so then while I'm getting admitted and they're, I'm getting put into my bed and like everything's, whatever. My mom is, again, it's very reminiscent of my son. She's sitting in the corner chair and the nurse is just chatting with me. And at this point I feel good because I got the Zofran via the IV. I was feeling okay. And again, I looked at my mom and I was like, something's wrong. And I couldn't even like vocalize what it was at the point. And my mom said that my eyes just rolled back and I just went backwards. They code, they do CPR on me. They get a pulse again. And when I came back to, nobody else was in the room anymore, except for my mom, one nurse, and one doctor. And I didn't even ask what had happened because I just thought, oh, I passed out again, because like that's what I'm used to. But then I tried to sit up and it hurt so bad. And I was like, oh my gosh, why does that hurt? Like I need help sitting up. And the doctor was like, yeah, we had to perform CPR on you. Like, we're going to have to like x-ray you, see if your ribs are broken. You're going to be sore for a while. And I had bruising all over my ribs. And I like looked at my mom and she was, oh God, it's going to make me cry. Like my mom was like,
watching her daughter go through that.
Yeah. And like, she just looked absolutely terrified. And I wasn't terrified because like I didn't know what had happened. I was more scared with my son because I was like aware and conscious. This one I wasn't. And so at that point I had to be moved to a medical facility where they like specialized with this. And I just had so many doctors that were like, we don't know like how to handle this. This is like more than we've ever, they were like, we can't keep you in the maternity unit. This is just so much more severe than that. They had to move me to a medical unit. So I was on a maternity unit and I got switched to a medical unit. And at that point, they were going to do a PICC line on me so that I could get nutrients put in me permanently. And they had to cancel the procedure because of the cardiac arrest. So at that point, then they were talking me through my options and they were like, well, we can't do a feeding tube because you're retching so severely that the feeding tube could puncture your organs. And I'm like, what am I supposed to do? And they were like, we don't know. Like we are out of our options. We don't know what to do other than to just keep you here. And I felt so alone, just like sad because I'm like, my son, like I need to be there with my son. Yeah. And so then I'm in the hospital for a few weeks. I finally get out. And at this point too, they were like, you can't be on Zofran that often. So we had to be on 13 medications. I was on 13 medications that I had to rotate every 2 hours. To keep myself from going back into cardiac arrest. I also couldn't have any medication that was in the same class as Compazine, the medication for my first pregnancy. Yeah. So it was like so stressful trying to keep track of my symptoms and make sure that I'm safe. And then I finally get out of the hospital and I continue doing my treatments. And I'm thinking, okay, like I'm almost 12 weeks. And with my son, I started to feel really a lot better at 12 weeks. Yeah. And at 12 weeks, we announced I was pregnant. And a few days later, we're driving home from a grocery store and I felt a huge pop and my pants completely soaked in blood down to my ankles. And I'm screaming because at this point we knew it was a girl. We knew like, it was just like, I had watched her on the screen and I had been through some terrifying things and I knew I probably couldn't, have more kids because it was so severe. And so I call my mom, I'm screaming hysterically that we are losing the baby. And she meets us at the hospital to grab my son from his car seat. My husband wheels me in and I'm just beside myself. I can't even speak at all. And they put me in the ER room and oh my gosh, it feels like 100 hours when you're waiting for answers. You're waiting to find out if your baby has died and they just like, nobody comes in to see you. The only person that would come in was a nurse to change the pad from underneath me that was filling with blood, like just filling with blood. And they come in, finally an ultrasound tech, they come in and they do an ultrasound. They said there's a heartbeat, but you're probably going to lose the baby this weekend. You're immediately on bed rest. Just go home, follow up with your OB on Monday. And I'm like, oh my gosh. So I go home. My family is very supportive at this. They're all helping me out, taking care of my son while I am at home, just thinking I'm losing my baby while I continue to bleed. And on Monday, I go into my OB and my OB goes, oh, so it looks like you've had some spotting. And I was like, some spotting? I was like, do you want to look at my pants right now? Like, it's bad. Like I'm gushing blood still. And she was like, oh my gosh. So then she sends me to an MFM doctor, maternal fetal medicine, for anybody who doesn't know. And they do an ultrasound and they pull me and my husband in a room without telling us anything. So I'm like, okay, what is it? And a doctor walks in, a new one that we had never met before. And she says, I have a subchorionic hematoma on the inside of the sac, and it is covering 60%, and it is taking nutrients from the baby. So she is not developing properly. She walked me through all the risks of not only to the baby, but to me. She was like, you have a high chance of bleeding out and hemorrhaging and dying. Your baby more than likely won't make it full term. And if she does, she won't be developed properly. You're at a much higher risk for miscarriage throughout the remainder of your pregnancy. And they said, with your complications that you already have, we recommend that you terminate the pregnancy. What do you want to do? And they leave me alone with my husband. And I'm like, no, it's a girl. We've watched her kick on the screen.
It's your baby, Laura. You're right.
Yeah. And everybody's different. But for me,
exactly. Everybody is different. It's everybody's journey. But what did you? Yeah.
Yeah. And not to be dramatic, but I just had already been through so much those first 12, 13 weeks that I just thought, I had already kind of envisioned bad scenarios of me dying. And I'm like, okay, let's say I don't make it during delivery. At least she will make it. And then you'll have this memory of me through her. And my husband was furious. And it's not like he wanted to terminate, but he also was like, but I don't want to lose you.
He doesn't want to lose his life with you. Right, Lori?
Yeah.
A lot to really pros and cons weigh.
Yeah.
And I'm saying pros and cons for lack of a better word, but realistically, birth isn't easy. And 1 in 3 of us are experiencing birth trauma. And it's just to say, it's traumatic, like some experiences are. And you go through months and months and months and weeks of, this, you're going through, Lori, and you're already so invested in this. And it's like, you almost, for me, I would want that happy ending at the end, or at least to bring the baby, your baby to full term. Right. I get it. I see it. Exactly.
Yeah. And not to be very dark, but you said some of my story is mental health. There was a part of me that didn't necessarily care if I passed away. There was a part of me that was like, you know what, if that's my story, that's my story. And at least now I can say that I died doing something courageous, trying to give life to my daughter instead of, dying in a darker way. And a lot of negative thoughts went through my head. And the doctor came in, I told her no. And so she was like, okay. So she brought in paperwork for me to write out my will. And I had to sign it. My husband had to sign it. She had to sign it. And I just remember my husband, we're all sobbing. And I called my family to let them know. And my husband and I didn't fight about it, but there was this tension and this elephant in the room. And then I would say to him,
Lori, yeah, I get it. Yeah.
After that happened too, I would, make comments if this happens, and he would be like, stop, don't say it. And I'm like, but I have to talk about,
I have to process it. Right.
Yeah. And I have to talk about the reality that there is a chance that these bad things can happen. Yeah. And so, I won't go into all the things, but the remainder of my pregnancy, I hemorrhaged. The remainder of my pregnancy, I did puke. So it wasn't like my son's. I didn't get better after 12 weeks. I didn't get better after 20 weeks. I had hospitalizations up until the very, very end. I developed anemia because of all the blood loss. And then I also was having severe bowel obstructions because of the medications that I was on. And so I was bleeding 3 ways. I was puking blood, I was bleeding, hemorrhaging from the pregnancy. And then I was also bleeding from the other end because I had these bowel obstructions. So I just was lifeless. Like at the end of my pregnancy, I was truly lifeless. Any photos I look at myself from back then, I have no color in my face. I look dead behind my eyes. Like I just couldn't do it anymore. And so they told me during my pregnancy that I couldn't have more children. But there was just this like thing in me that thought like, no, like I can still have more kids. Like I didn't want to hear it.
Right.
And
especially in those moments right after. No, you don't. Yeah.
I just like, I was not in a space to hear those things, and I didn't want to believe it yet. Not to mention, I think still a part of me just thought like, oh, I might still die during birth. So like, this is the moot point to even be talking about it. And then, my delivery was perfect. I had her full term. I didn't have as much blood loss as they thought. And it's probably because I hemorrhaged throughout the pregnancy that I didn't have as much blood to lose at the end. Whereas like if somebody hemorrhages during the labor, that's when you have a higher chance of, passing. And so I had her, and I thought, oh my gosh, like we made it through. She's healthy. She does have health issues. And I still deal with like guilt of like, is it because of me? So then fast forward, I ended up still dealing with complications after I had her. So anytime I did start puking, the same thing would happen where I would retch until I would pass out or puke blood. I also was still dealing with bowel obstructions for 2 years. And we were like, what is going on? And I finally started seeing specialists to get some answers, and ended up finding out that I had a rotated intestine due to my pregnancies. I also was finally diagnosed with cyclic vomit syndrome, which is where your body perpetually vomits until you pass out or puke blood. And so it's like, I finally got these diagnoses, and I'm like, but what am I supposed to do with these now? Because there's no cure for the cyclic vomit syndrome. Right. So I started treatment to help me cope with cyclic vomit syndrome. And then I ended up having a surgery to fix my intestines. So I have a 15-inch scar across my stomach. And I haven't been in the hospital since April, which is the longest I've ever gone since 2019. But in the midst of all of this, we got the confirmation that I could not carry more pregnancies. It's too dangerous for me. It was too dangerous for the baby. And clearly my body is only getting worse with each pregnancy, especially because of the cyclic vomit syndrome. It just gets worse. And I have bad reactions to medications apparently. And when I got that call that I 100% could not have more kids, it literally sent me in a spiral. I was so hysterical that my husband had to take me to the hospital because I was having such a severe panic attack. And like, I've had panic attacks my whole life, but this was different. Like I almost was kind of like what you see in a movie where when somebody's having like a psychotic break, like I was saying things that didn't make sense. I felt like I was hallucinating, almost like things just didn't feel real. I was really having like a really bad like psychiatric response. And I called my sister, and my sister had come over, and she's, watching this happen, and she takes my kids so that my husband can bring me to the hospital. And they calmed me down. They basically tranquilized me. I remember them giving it to me, and I just was like, whoop. And when I got home, I slept it off. And then the next day, I just cried. I just cried a lot because I was like, I can't have more kids. Okay. I talked to friends, I talked to family, and I was like, I don't know what to do because this is like, I'm not okay. Like, I'm really not okay with this, like this option. This doesn't feel like the right option to me. And so at first we looked into adoption. and realized that that's really expensive. And it's also really an emotional roller coaster, especially if you already have young children in the home. And so we started looking into surrogacy. And I actually talked with my pastor, and this is something that I just want to say for anybody else who's going through this. I kept saying to him, I was like, why can't this just be enough? Why can't my 2 kids be enough? Why am I willing to put myself through surrogacy just to have more? And he was like, because the choice was taken from you.
Yes.
And that's like, you have to grieve that the choice was taken from you. And like him saying that like really hit me, because I was like, yes, like it feels like it's not my choice. And that is a huge blow and a huge grieving process, regardless if you have children or not already. Yeah. I had to mourn that I would never feel babies kick inside me again. I had to mourn that I wouldn't experience anything. I also had to mourn the fact that I never had a pregnancy that was good.
Normal. I had like normal, as in like easygoing, no problems. Exactly, Lori. Right. Yeah. It's
and so it's like
those things. Yeah.
Yeah. And so I'm like dealing with all this. I'm dealing with the grief. I'm dealing with the mourning of the pregnancy. Right. Yeah. The trauma. I'm still dealing with symptoms that my pregnancy's left me with. Like for the rest of
my life, adjusting. Yeah.
Yeah. And it's like for the rest of my life, I have to deal with a lot of these things. And so we started looking into surrogacy, and again, just to keep things like short, but still tell that side, we ended up posting on social media because we couldn't financially afford to go through an agency, especially already having 2 kids at home. But again, to tell the side that like some people don't get to experience, I also really struggled with where I fit in that community. I started joining groups, and I would have people reach out to me and make comments like, well, at least you already have 2, or at least you got to have babies. I had people say that at least I'm still in my 20s. And I was like, I'm in my 20s, yes, but I can't have more children. Like this isn't, oh, well, there's hope for me to have more in the future. No, I was told I can't. And I felt like I didn't have anybody to talk to. Everybody else in the community was struggling getting pregnant, struggling maintaining a pregnancy. I had not met anybody else who had to go through surrogacy due to a traumatic pregnancy, or birth trauma, or basically like you can get pregnant, but you can't carry a safe pregnancy. I hadn't met anybody. And it was really, really hard. And I would see posts because I joined a group that had intended parents and surrogates. Yeah. And I remember I would see posts from surrogates that would say things like, I'm choosing between which family to carry for. One has, no kids, and the other one has a son. Who should I carry for? I'm closer, or I feel more connected to the family with a kid. And all the comments would say, without a doubt, you give the family without kids a chance. And I would see those things and I would be like, nobody's going to carry a baby for me. Like I wouldn't carry for somebody who already has kids. I would want to carry for somebody who doesn't. And so I felt a ton of guilt when we shared our story. Like, people are going to be like, you should just be grateful, which I did. I got those comments. I got the DMs of people saying, just be grateful. I don't understand. You have the all-American family. You have a boy and a girl. Why would you want to mess that up? This is so expensive. Just every comment. I had people tell me, one of the worst comments that I got, I had somebody say to me, I vote that you just have another shitty pregnancy. And I was like, I know that I have been inconspicuous on my social media, and I just call it traumatic pregnancy. So people can't necessarily understand how actually severe this was and how like jeopardizing it was to my life and my children's life. But to have somebody say like, I vote you just have another shitty pregnancy, I was like, you do realize, like, I almost died twice, like this, and I'm not being dramatic when I say that. Like, I had a stroke in my first pregnancy and I had a cardiac arrest in my second, and then I hemorrhaged my entire pregnancy.
Right.
And so, yeah, it just was all the comments, but we found a surrogate via social media. She only lives 20 minutes away. So it was the perfect situation for us because I wasn't willing to settle. I know some people who don't have children, they just want a baby. For me, I will say having 2 kids did make it easier for me to turn down people that it didn't feel right with. Whereas when it did feel right, you know, somebody who is close by so I can feel their belly as much as possible, so I can go to all the appointments, so that I can have them over for dinner and actually develop a friendship. Everything aligned with her. And then it basically was just a struggle to get to the place where, so we met her in May of 2023. So it's been a year and a half. So then we struggled to make embryos, which we thought, I was very naive, and I was like, well, we don't have fertility issues, so we'll make 1 million embryos and then we can donate them to families. And we struggled to make embryos. And so I did 2 egg retrievals. And after the second egg retrieval, we finally made embryos. And then as soon as we made embryos, then we had to get things squared away with our surrogate and then finances. And it's a long process. So we're finally pregnant, and our surrogate is 12 weeks. And so we're due in May, and we are so excited. Yeah.
Lori, thank you so much for sharing your story, and, you know, so much to say or comment on. And gosh, I just can't thank you enough for doing this for, you know, our survivors to hear and things like that. But just a couple things, you know, just to say about, it's so true. And I know you and I talked post-show or pre-show about this, about, you know, it's so sad when people compare each other's journeys because we're all so different, but we're all dealing with reproductive trauma. The ones I'm talking about, our community at Chasing the Rainbows and things like that. And, you know, and various things. And when you're talking about like reproductive and birth trauma, like we're all walking the same staircase, or just different colors. And why are we comparing losses? We're all trying to do the best we can. And I think, you know, out there, if we could all do a better job of just holding space for one another and being each other's safe spaces instead of justifying out, or, you know, you at least have this, or you should be grateful for this. And it's like, no, like breathe, like everybody's journey is different. We shouldn't have to justify it.
Yeah, definitely. And it's the one thing that's been, you know, the positive, and I always say this because I'm so open on my social media, which some people criticize me for that too. You know, why do you share so much?
Outlet. It's a great outlet if, Lori, you know, and you do a great job having a voice on there. Exactly right. It gives you a voice.
It gives me a voice. And it also, for the mean and negative comments that I get, I also get the people who reach out. I've had multiple women reach out and say, I'm pregnant. We haven't shared publicly yet. I'm having a really tough pregnancy, and you're the only person I could think of that I could reach out to talk about my pregnancy. And I've also had women who are like, I know it's not as bad as yours. And I'm like, nope, stop. I'm like, this is not, mine isn't as bad as yours. I can't complain. You can complain. Point blank, period. You can complain whenever you want. Trauma is trauma is trauma is trauma, and pain is pain is pain.
Agreed.
And I always stop people if they say that to me, because I've felt that. I have talked to somebody and felt like I don't get to be sad because it's not as bad as theirs. And I don't want people to ever talk to me and think, well, mine wasn't as bad as you. It's like, no. Like, we're all struggling, and we all just have to be there for each other.
Exactly. And we say that too. We say loss is loss, because infertility, you're dealing with so much baby loss there, and month after month, and all of those things. And to not go on, and if your journey takes you where you know, don't have biological children, or whatever that journey looks like, and it's grieving all of that, Lori, like we discussed. And then also, miscarriage and infertility and miscarriage are so silent because a lot of people don't know you're on it unless you tell them and share that with them, or know that you've experienced, baby loss early on and things, but it's at any stage or age. And it's why are we comparing, some, like for myself, having an infant daughter who I lost in the NICU, why are we comparing that to a miscarriage? They're both baby losses. They're just both different experiences, but we can feel so much healing when we come together in empowerment that, we are helping the next person by sharing our stories and our experiences because, Lori, that's what it's all about, for those to come out of the shadows and not feel alone and isolated like you and I both have at one point or another in our journeys.
Yeah, absolutely.
Yeah. Well, thank you so much, Lori. I can't thank you enough for being on here, sharing everything that you have. And thank you so much.
Yeah, of course. I'm always here for anybody who's listening. I'm here whether it's about infertility or loss in that way, but also mental health. Like, I struggled with mental health long before it came to any of this. Yeah. And it's something that I'm really strongly passionate about. So yeah.
Thank you, Lori. Oh, thank you. Yeah. And we'll include Lori's handle in our Instagram post and everything. And you can learn more about her story. Remember, no matter where you are in your journey, there's always hope and there's a community here for you and Chasing the Rainbows. So thank you for tuning in to Cry It Out Loud, and we'll see you next time. Thanks again, Lori.